Welcome to Fertilish, the podcast where we get real about fertility, infertility, and everything in between. I'm Laura.
And I'm Brandis. And whether you're knee-deep in treatments, just starting to ask questions, or somewhere in the ish of it all, you're in the right place.
Here we ditch the stigma, break down the science, and have candid conversations about the messy, emotional, and sometimes hilarious journey to growing a family and preserving your fertility.
So grab your coffee, your meds, or just your curiosity, and let's get into it. All right, so we are back this week with another episode of Fertilish, and today we are talking all about marijuana and fertility and trying to conceive.
Yeah, I think this question gets asked a lot. How, let's say I have a medical marijuana card. How far in advance do I need to quit smoking? Do I need to quit smoking? Do I need to, what part of my treatment do I need to quit? So I think this will be something that a lot of people can get information from and be useful to a lot of people.
Oh, yeah, and marijuana is one of the most commonly used drugs worldwide, and this goes for all forms, so edible forms, powder forms that you can drink, smoking, vaping, all the things.
Wait, powder forms that you could drink? I didn't even know that existed.
Yeah, they come in like pouches, and you could put it like in a drink. Yeah.
Had no idea.
Yeah, which is huge because I feel like it is so common. It's legal in some places. And so, the thing about it is that it can have a huge impact on males and females and fertility overall. And I don't think a lot of people realize that.
Yeah, no, I agree. Everybody knows I love, reality TV. And maybe like 6 months ago, there's a couple on there that they were trying to conceive, and on Teen Mom, they were trying to conceive, and he smokes frequently, and so they went to a fertility clinic, and he got a semen analysis and got, less than ideal results. And so he made a commitment to quit smoking and went back sometime later for another semen analysis, and his results had improved drastically.
Yeah, so that's crazy. I didn't even know. I'll have to go back and watch that. So yeah, it can affect sperm and eggs, and I guess we'll start out just by kind of explaining how marijuana works. Marijuana actually acts on the hypothalamus part of the brain, which produces gonadotropin releasing hormone, or GnRH. GnRH signals to the pituitary gland to release follicle stimulating hormone, or FSH, and luteinizing hormone, LH. So in females, follicle stimulating hormone is just like the name. It stimulates your follicles to grow in the beginning half of the cycle. So it stimulates those eggs to start growing and maturing. And then luteinizing hormone, or LH, is that hormone that we're testing with those ovulation predictor kits. It's the hormone that signals to the egg, hey, ovulate. So when that signal to produce FSH and LH they're not releasing appropriately, or we're getting these abnormal amounts, you can have issues with menstrual cycles, ovulation, irregular cycles, delayed or lengthened cycles. And then in males, luteinizing hormone, or LH, is responsible for testosterone production, and follicle stimulating hormone, or FSH, is actually responsible for sperm production. And so both of these hormones that are affected play a significant role in infertility.
Yeah, and I'm glad you mentioned the irregular cycles and ovulation, because even if you're having regular cycles, which we've talked about on prior episodes, it doesn't mean that you're ovulating or that everything is working as it should. That it's not having an effect. So just because you're still having 29-day cycles doesn't mean that there's not some other issues going on.
Yeah, and you brought up that episode where the male partner stopped smoking or using THC, and his sperm improved. So sperm actually, and we've talked about this before, regenerates every 3 months. So I always tell people the sperm that comes out today was made 3 months ago. So normally for males, I'm telling them to stop smoking 3 months or stop using THC 3 months before we're starting to go through this process. And then females, unfortunately for us, we don't make new eggs. And so those eggs kind of absorb the wear and tear of our life. But the sooner you can stop using THC, the better. And another thing to know, with a semen analysis, we're looking at things like sperm count, so how many sperm there are, motility, how fast they're moving, morphology, the shape of the sperm. And one thing that we're not really looking at is the functionality of the sperm with the semen analysis. So we can't tell, is the DNA fragmented in there? Is it working like it should? We do have a DNA fragmentation test we can do. However, the way that we treat DNA fragmentation is with ICSI, or intracytoplasmic sperm injection, where we are injecting each sperm in each egg. So we're kind of already treating that, but there are so many things, really in sperm. Is it functioning well that we don't test with the normal semen analysis? So even if you smoke weed or use THC and your semen analysis was normal, it doesn't necessarily mean that you're not affected.
Mm-hmm. Yeah, that's a really good point to make. So just because you had a normal semen analysis doesn't mean that you've, kind of beat the odds.
Yeah. Well, and in men, because it does affect testosterone production, it can cause, even in short-term use, can cause symptoms of low T. So these are things like, fatigue, low libido. It can actually shrink their testicular size because it's not, they're not producing these hormones like normal. And it can actually increase disorders like erectile dysfunction or ED in men. And what's what I'm looking for, can cause orgasmic disorder. So it's also harder for them to orgasm, which again would make it harder to get pregnant.
Gotcha. Okay. Didn't know that.
Yeah, so fragile sperm in women, it can harm ovulation, which we've talked about, and menstrual cycles. Especially ovulatory dysfunction with higher doses, especially those in edibles. And studies, kind of some observational studies, have shown that women that have used THC within 1 year of trying to conceive actually have double the rate of infertility than people that don't smoke.
That's
so pretty
astounding.
Crazy. Oh yeah.
That's huge.
Yeah, and it's also hard sometimes to identify in patients because I feel like it's not legal everywhere.
Right.
And not everyone is going to report using it, or they have jobs where maybe they might get in trouble.
Yeah, there's
and
judgment
so
that comes with it. Yeah, yeah, absolutely. So I do think that, there are less than, or there are disingenuous, answers to that sometimes because they are afraid of judgment, and they may be using it for, a very valid medicinal reason, but like you said, it's not legal throughout the United States. And some places it's, legal for recreational use. Some places it's legal for just medicinal use only. And so there's different schools of thought on, whether it's something that you're able to use or not, or there's more judgment passed in some places than others.
Yeah, so important to know that when we ask you that question, it's not to, pass judgment or turn you into anybody.
No, absolutely.
Truly, it is to kind of advise you, because we hate for you to put money, time, emotion into a cycle with you not knowing this information. And then we have, decreased fertilization rate.
Yeah.
We don't get as many eggs. Nothing makes it past day 3. And we don't know how to advise you because we don't know this is something you're doing.
Yeah, that's a good piece of the puzzle for us to be able to have to make the, the picture just come in clearer, so that way, like you said, we can, plan appropriately.
Yeah. And even with people who use THC and that have done IVF, which is actually really interesting, we see lower pregnancy rates and a higher miscarriage risk. So with IVF outcomes, there was a study that looked at 221 couples. And those that use marijuana, it was linked to 25% fewer eggs retrieved.
Wow. And
also 28% fewer eggs fertilized, with a higher risk of pregnancy loss after doing IVF. So we know, that this has a great impact on eggs because we can also decrease your ovarian reserve with marijuana, and the male partner. So important for both people for sure.
So quantity and quality.
Yeah, decreases egg quality, quantity, also the environment that the embryo develops in. So there was another study in the lab where embryologists basically put these embryos in a dish with the amount of THC in serum levels that just a normal average user would have. And they saw that, embryos were not able to go through meiosis II correctly. They were not able to develop correctly, and there was a loss of DNA integrity. So huge impact even for environment and inflammation where the embryo has to develop.
Wow. That's a significant decrease. 25% fewer eggs retrieved and 28% fewer eggs fertilized is significant.
Oh yeah, and in males, the semen analysis, looking at that side, like we kind of talked about, we are seeing lower sperm parameters overall, but lower counts, reduced motility, teratospermia, so abnormal morphology or shape of the sperm, and then you get those levels of DNA fragmentation. And when you're talking about IVF, those attrition rates are huge. Yeah. So I always tell people, not every follicle in your ovary is going to have an egg. Not every egg will be mature. Not every mature egg will fertilize. Not every fertilized egg will make it to blast. Not every blast will be normal. And then not every normal embryo will implant and result in live birth. So why not optimize the things we can to increase those numbers?
Absolutely. Yeah, absolutely. You want to do everything that you can to, make the process, as difficult as it is already, most fruitful for you. Yeah.
And, even people that say, okay, well, I smoke every day, I'll stop to once a week. Even, that short term use can significantly reduce sperm counts, can affect egg quality. And so really we're just saying overall, try and completely stop any form of THC. And, another thing, and I know this is the other frustrating part, is because I feel like I bring this up to people when they report use or they ask about use. And, my friend smokes all the time and had a healthy baby, or, my friend smokes weed and cigarettes and they get pregnant no problem on the first try. And that's what's so frustrating, because we have people trying to do everything right.
Yeah.
And then you have these people over here who are doing whatever and it's working for them. But again, it's from the standpoint of
people who are accidentally getting pregnant and weren't even trying to have children. Yeah, like as a fertility patient, I can tell you that nothing is more frustrating when you're like, you were doing everything wrong, didn't want any more kids, and then here they come,
Or especially when they're like, yeah, I was on birth control and I got, it's like, yeah, it's frustrating because in your, the timing when you work in this and you're a patient in this as well, you realize how specific everything has to be, the timing, the amount of progesterone hours, all these things. And it's crazy to think that happens in real life, like with no help.
No, 100%. Like the stars have to align just perfectly at a certain time of day. Like all of these things have to align up just to like fertilize an egg. And then from there to grow to be an actual embryo. And then from there to, to implant and actually have a clinical pregnancy. And then that's not enough. You've got to go basically 10 months through a healthy pregnancy, healthy delivery, and then your kid's expected to be cute and smart at the same time. So
the worrying never stops.
If all of those things happened, holy crap.
Yeah, I know. Everything just has to like line up, and it is wild. And it's also important to note that a lot of the studies we have, especially when it comes to marijuana use, are in animals, right? Because we're not going to give pregnant women or women trying to conceive or males THC and say, well, let's see what happens, because it's not ethical. So most of them are in animals. And then most of the studies we have, like in the IVF population that I mentioned, those are retrospective kind of observational studies. So those are, people that reported use. Let's look back at their cycles and see kind of what happened, which we also think is a lot lower because a lot of people, like we talked about, don't really report use.
Yeah, or if they do report use, it's probably minimalized. Like, I'm using it on these intervals instead of the intervals that, that they're realistically using. So I'm sure it's, there's different stages to accurate reporting.
Oh, yeah. And again, we mentioned short-term use and long-term use. It doesn't, or chronic use, or once a week, or every day. Both things can affect fertility for males and females. Even the ED and the orgasmic disorders. Short-term use, we do know that marijuana can act as an aphrodisiac, so people can have more sex, but then you're still having lower sperm counts. Decrease in egg quality, decrease egg count, and so it's still affecting you, short-term as well.
Or you're having problems maintaining erection throughout intercourse.
Yeah. And then we know, once someone gets pregnant, that THC can cross the placenta, which is obviously meaning that it's affecting the placenta and baby's getting it, which is, can result in things like abnormal function of the placenta. Or placental abruption, which is where that placenta completely detaches from the uterus. That's an emergency, can be life-threatening for both mom and baby. Growth restrictions, preterm birth. It also, low birth weight. It can result in NICU admissions, and actually infant death within 1 year, which is awful because you've just went through, trying to get pregnant, paying for IVF cycles, and then to have that happen. So once you get pregnant, that's not the sign to say, hey, we, made it, it's safe now.
Right.
And then stillbirth data is kind of mixed. So we don't have a lot on that, but those are significant things to both yours and baby's life.
Like, I can't think of too many more things in life that are traumatizing. Like, to have gone through infertility and then fertility treatment and then, to have this precious baby and to lose a baby, there's not a lot of things in this world that I can think of that are worse than that. So those are definitely things that, if we can put something on pause for a period of time, to prevent, higher risk of these. Obviously, all of these things can still happen if you've done all of the things that your provider has advised you to do. All of these things are still a risk. But if we can minimize that risk, then that's obviously what we want to do. Yeah,
and not even just speaking to people that are doing IVF.
Right.
But anybody concerned about their fertility, or trying to conceive. I do get a lot of, my friend or aunt or whoever smoked weed throughout their whole pregnancy because it's natural and they had a fine birth and things went okay. So it doesn't, like you mentioned, that's not even, to me, worth the risk, because now, even though a baby's born, you still have an increased death risk within that 1 year. And we know that it can affect children well beyond pregnancy. So it does, result, as far as child development goes, with prenatal exposure. These kids have higher rates of anxiety and depression. They have gaps in their problem solving and their memory. They have shorter attention spans and a multifactorial one, but we have seen higher risks of autism spectrum disorders as well, which again, that we know is multifactorial, but these are things that THC has had an impact on well beyond, egg quality, sperm quality, pregnancy, birth. It's going, it's affecting these kids for their whole lives.
Well, you can also smoke cigarettes for all of your life and not get cancer. There are people that have done that.
Exactly.
It's not a guarantee that you're going to get cancer, but you're at a much greater risk of developing, lung cancer, throat cancer, mouth cancer, etc. And so, and you're also at risk for developing other things like congestive heart failure, emphysema. So it's not a, to your point, like smoking marijuana is not a guarantee that these things will happen, but it increase the risk.
Yeah, and even you brought up smoking. Smoking is another one of the things, we've talked about this before. If you have a vault of eggs that you're born with, there are few things that can get into that vault. We know chemotherapy is one of them. That's why people freeze eggs before chemo. Marijuana is another. Cigarette smoking is another. And cigarette smoking is actually another thing that can actually increase chance of miscarriage, decrease egg count. And that also goes for secondhand smoke. So if you're being exposed to something, or if you're smoking around somebody that's younger or is trying to conceive, that's having an impact too.
Absolutely. Not on the fertility spectrum, but I actually knew this gentleman that was like a friend of our family's, and he commuted to work with a gentleman for years. They lived in the same town, and they, commuted about 45 minutes away to the same employer, and the gentleman that he commuted with smoked, and so he would smoke every morning and every evening on their commute. And he actually got lung cancer from that secondhand smoke.
And the guy that smokes is probably fine. Has no cancer, is healthy, lives to 105.
So he, it really does affect. I was probably like in my super early 20s when that happened. And obviously I had heard about the risk of secondhand smoke, but that was like the nail in the coffin for me. I was like, holy crap. That was very eye-opening to me about how much damage that secondhand smoke can really, contribute to.
Yeah, and what's crazy about stuff like that is you really, day to day, don't really notice these small changes that are happening, because if you think about it, eggs are cells. And
right.
So if secondhand smoke, marijuana, fragrances, all of these things are affecting these cells, we know that because we can see them. But I always think about man, what, we see these eggs that come out, and sometimes they'll degenerate, or you have embryos that aren't growing. And to see that firsthand, because I think you hear it all the time growing up about, don't smoke, don't do these things, limit these things. Perfume's not great for you. Bath and Body Works, which I have all over my house.
God. No one loved a Bath and Body Works candle sale more than Laura. No one, okay? I would tear a Bath and Body Works store up on candle sale day and order some online. I had literally a closet dedicated to Bath and Body Works candles. But starting through this fertility journey, and I always had wallflowers in my house too, like the plugins or whatever. And then starting this fertility journey, and I was like, oh, that's literally the worst thing in the world.
That's so funny. I know. And I'm a big wallflower and candle person. And I don't wear perfume here. But I have a perfume that I love. Oh my God.
Yeah. I love perfume.
You know what? Yeah. I don't smoke. I'm going to pick my battles. But, if I was trying to conceive, I probably would stop those things. Because why not optimize everything?
Yeah, people in my life were absolutely shocked that I gave up, especially my Bath and Body Works candles. They were like, what? You okay, girl?
My cousin had bought me plastic bowls for my kitchen, and I don't use anything plastic because of all the studies, microplastics that we've had, and they put you into menopause sooner and all this stuff. And she was like, oh, they're BPA free. And I was like, yeah, but then they have sister BPAs that they could have. She was like, okay, you have candles and wallflower. And I'm like, okay, but that's why I limit what I can, okay?
I did switch to glass containers, and I switched some of our stainless steel, our non-stick cookware to stainless steel, and but obviously I still eat crap sometimes. So I know that I can't do all the things perfect all the time. Yeah. And even if I did, I walk outside and there's pollution in the air and you're breathing,
Yeah.
So you're going to be consuming toxins some way, but if we can limit, and like you said, pick your battles.
Yeah.
And, Bath and Body Works candles were something that I could begrudgingly give up on. You know, and I still have fragrance in my house, but I
Yeah.
switched to like the Pura things. They say they're clean. They'll probably in 3 years probably be like, these are worse than all the other stuff you were using.
Yeah.
But, you know, I tried to do like the essential oil, like the, not the, whatever, the one that's better for you, the little diffusers that are better.
Yeah.
So, you know, I tried to do some things that still like gave me some joy from fragrances because I do love smell goods. But that still, you know, were a little bit of a healthier choice, I guess.
Yeah, and this goes back to, you know, you can't control everything.
Yeah.
You're going to be exposed to plastics and everything else.
Well,
Just
you're
in
gonna-
general.
Yeah,
For
I mean-
fragrances, go to a store, but optimize what you can. And, you know, marijuana is one of those things that
Yeah.
we know has huge health impacts on pregnancy, children, trying to conceive. So, yeah.
Yeah, I mean, you're going to be driving down the road and somebody in front of you is going to be, you're going to be, you come to a standstill and somebody in front of you is going to be smoking in their car or, you know, and you're going to smell it or you go, you know, to Target and somebody's smoking a cigarette in the parking lot or at a gas station or
Yeah.
whatever. So like there are going to be times where you're still going to be exposed to things that, you know, maybe you're trying to limit, but like you said, just limiting, the consumption of it, it does help.
Yeah, and this doesn't, you know, mean that if you use THC in any form that you can't get pregnant. So
Right.
don't use it as like a birth control, because you can. And, you know, I think the key points to this talk is that, you know, it affects males and females greatly, decreases sperm counts, increases kind of, I guess what's the word I'm looking for, hurts DNA and egg and sperm, hurts the quality, decreases count of eggs, increases chance of miscarriage, has, you know, great impacts in pregnancy and can cross the placenta and affect that. And beyond pregnancy, you know, these children or these kids can have these developmental disorders. And so even if it's not something that you're seeing right away, you know, this use does impact short-term and long-term.
Yeah, absolutely. And, you know, I think that like a common thing that I've heard is, you know, well, I have millions of sperm, like, you know, in each sample, like I have millions of sperm, you know, millions and millions of sperm. Like surely there's going to be some normal ones in there. Well, the average male, when they, you know, go for a semen analysis, the majority of their sperm are not going to be, are they going to be abnormally shaped? They're going to have two tails or two heads or be bent, to, you know, like all of the things. So you only have a small percentage of the millions of sperm. If you have a good semen analysis, which is quote unquote normal, you only have a very small percentage that actually are normal, that move, you know, like they're supposed to be moving. And so we want to make sure that you're, you know, keeping that small percentage for use for trying to conceive.
Yeah. Well, and yeah, you bring up a good point. You know, with a semen analysis, when we look at morphology of the sperm, on the scale we use, we only need 4% of those or more to be normally shaped. With, you know, which doesn't seem like a lot, but when you have 15 million or higher amounts of sperm, it is quite a bit. But when we're looking at sperm under the microscope, you know, we're not looking at, well, does this sperm have good DNA in it? Is this
Right.
DNA fragmented? You know, even though we're doing ICSIs, morphology, abnormal morphology in sperm, you know, is more complicated to treat. And again, even if morphology is normal, we've had a couple patients now where, you know, the partner would smoke weed and didn't necessarily say anything about it. We ask, but again, not everyone discloses it. And they'll go on to do IVF, and we get embryos that make it to the day 3 stage. So actually, fun fact, I don't know if I mentioned this before, it's the female's, the egg's job to make it to day 3. And then once they're at that day 3 stage, it's the male part, or the sperm's kind of chance to kick in to get it to that day 5 stage. Now, not to say that every embryo that doesn't make it to the day 5 stage is the male's fault, but that's kind of when that male genome kicks in, is to get it to day 5. And so if we're seeing a lot of, arresting embryos at day 3, sometimes we'll regroup after an IVF cycle and say, okay, what did we miss? Tell me about your lifestyle. And sometimes marijuana will come up. And so then we'll say, try and stop it at least for 3 months, healthy lifestyle, all the things. And these people have, improved rates. Mm-hmm. So even if we're not seeing it on a semen analysis, it can still affect the cycle.
Absolutely. And to your earlier point, you can continue to have miscarriages. And then even if you do have a healthy live birth, it can cause problems afterwards. So, I would assume that's not just on the female, that's on the male as well. Like,
Mm-hmm.
The male DNA is contributing 50%. So,
yeah.
I would assume that's also contributing to, developmental delays, and complications with a child after birth as well.
Yeah, and even with so if you do genetic testing of embryos and you get a euploid, which is a chromosomally normal embryo, we do have people that have miscarriages with those
Right.
embryos. And, we always talk that testing is pretty accurate. It's not 100%, but it's up there. Not only, though, does an embryo have to be chromosomally normal, but there are so many other things functionally that have to happen in chemical processes to result in a live birth that we don't have tests for.
Right.
We don't probably know about. And so, that can play a role in all of these things. And yeah, we do see a big increase in miscarriage with use on both sides.
Yeah.
I think we went through, a lot of it, how marijuana, kind of acts on the body, why it affects the things it does. Do you have anything else you think you'd add?
No, I think just like the crux of obviously this conversation would be, like being upfront with your provider so that they can help you to be able to formulate a treatment plan that's going to be that's going to work best in your favor and for your goals, and without judgment. Like, we're not passing judgment at CNY. That's not what we're here to do. We just want to know all the facts so that way we can best advise you. And then B, if you do think that you may be trying to conceive in the near future, it is something that you definitely want to consider to limit or cease, consumption of marijuana. And again, no judgment on our parts, but the more that the more information you give our providers, the better they're able to assist you on next steps.
Yeah, anything we can optimize to have you, have a healthy baby, to get pregnant, we're gonna try and help you do without judgment. So definitely something to disclose. If you're trying to conceive and it's not happening, or you're having miscarriages, and that's a factor, definitely something to think about. You can look up studies for yourself if you would like. Like I said, a lot of them are kind of looking back, retrospective studies. And I feel like, more data will probably come out in the next few years now that it is legal in more places and people are kind of reporting usage more. So, yeah, something to pay attention to, and another thing to optimize your chances.
Yeah, absolutely.
All right. Well, that about wraps up this episode. It always is helpful when you guys send feedback, comment, review. We get your messages, and they always are great to read. So.
Oh my gosh, yes. That on an episode that came out recently, we were talking about infusions. We had so many people that reached out to give us places that they had gotten intralipids, and that has now developed into some new partnerships for other patients, and so we really appreciate that. We love getting your stories about what you're going through and how we can support you, and so that it's very, very meaningful to us for sure.
All right. Well, we will see you guys next week.
Yeah, see you next week.